Rising along the Pacific Rim, spanning mountain, jungle, and sea, Papua New Guinea is said to be home to more than 800 indigenous languages. For the past 11 years, Dr. Rebecca Morsch has been speaking one that is understood by all, the language of compassion. Dr. Becky, as she is widely known, is Director of Community-Based Healthcare, a program of the Nazarene Health Ministry. From her base in the rugged Papua New Guinea highlands, she trains volunteers and village birth attendants to provide holistic health services in one of the least developed countries in the world. Many of those she has trained have gone on to become trainers themselves. Dr. Morsch even helped organize the country's community health organizations into the Effective Development Empowering the Nation, or EDEN network, and has brought her expertise to other parts of Oceania, including Vanuatu and the Solomon Islands. Huge accomplishments for someone who didn't even start her career as a physician. One of 5 children growing up with a pastor father who set the example of service, she graduated from Southern Nazarene University in 1974 with a social sciences degree. For 15 years, she was a social worker, using her talents in child welfare in the United States and beyond. It was in 1989, on a trip to India, that she encountered a community-based healthcare program that trained women to provide simple health services and teach their own communities to stay well. It was life-changing, for them and for her. Becky Morsch was then in her mid-30s. She was 40 when she entered the University of Kansas School of Medicine. It wasn't easy. She didn't have a strong life sciences background, and she found out she had a learning disability. But she persevered, graduating in 1998. She did her residency and earned a Master's of Public Health degree from Loma Linda University in California. And in 2002, she arrived in Papua New Guinea. She learned Melanesian Pidgin, the country's lingua franca. She also learned she was desperately needed. She walked and sometimes rode into remote villages where infant mortality approached 90%, where AIDS, syphilis, and cervical cancers were on the rise, where people had never worn a pair of shoes or encountered a toothbrush. Her commitment has been unwavering. Even when she was faced with her own cancer diagnosis in 2006, she returned to Papua Guinea as quickly as possible after being treated in the U.S. Over the past 11 years, the rewards have been many. It's not just about the chickens she has received, or the babies named in her honor, or even the feasts. It's not even the rare opportunities to host her own family, which includes 2 physician brothers, one of whom has his own humanitarian organization. It's the knowledge that she is making a difference in medicine, in her faith, and in countless people's lives.
For a woman that just came out of the bush of Papua New Guinea about 2 days ago, this is a little bit of a culture shock. But I sure am happy to be here. Thank you, AMA Foundation, and Dr. Chu, wherever you are. Yes, thank you for such a great honor. Thank you to Pfizer for hosting this event. I want to thank Dr. Alan Sawyer, who flew in from Arizona yesterday to be here, because he was the one that nominated me. He saw things in me that I didn't see in myself, and I thank you for making the nomination and twisting the arms of a couple of friends to write letters of recommendation as well. I also thank my family. They have, my father began it, and my brothers and sister have continued it to show the way in service, and I thank them. I thank especially Lori, Vicki, and Gary for coming this evening and celebrating with me. This award may have my name on it, but it isn't just mine. It belongs to a lot of people. First of all, I'd like to thank you on behalf of the Church of the Nazarene and Nazarene Health Ministries in Papua New Guinea for giving me a place to serve. On behalf of all the people who have donated over the years to make it possible for me to be there and to do the work that I'm doing. For one particular colleague named Matthew Gallman, he's a Papua New Guinea man who works circles around me, and he will be carrying CBHC, community-based health care, into the future. I'm receiving this on behalf of my colleagues at Kujip Nazarene Hospital as well. Every single one of them is more deserving of this award than I am. And yet, I have the privilege of being here. I also thank and feel that this is an honor on behalf of thousands of Papua New Guinea, Vanuatu, and Solomon Island people who have been trained in community-based health care and took what they learned to heart and underwent the kind of changes voluntarily that made it possible for them to be healthier in body, mind, soul, and spirit, and then led that same charge in their family and led it in their community, so that there are many, many communities that have been transformed because of their influence. Mother Teresa, she seems to be popular tonight, and so I'll quote her as well, said that she was a pencil in the hand of God. And I've thought and reflected about that quite a bit and believe that is my role. So as you honor a pencil, you are even giving more honor to the one who is writing the story, and that is our creative God, who opened my eyes to the need and the potential of community-based health care, and then inspired me and gave me the passion and the courage and whatever other qualities were needed to be able to do this job. If I could give some advice to the medical students and residents, and I can because they haven't turned my mic off yet, if I could give you some advice, it'd be simply three things. Number one, follow your passion. Number two, follow your passion wherever it takes you. And number three, you're never too old or young to discover your passion and to follow it wherever it may lead. Thank you.